Welcome to Between Doctors and Friends, hosted by board certified physicians Dr. Foz in primary care and Dr. Ray in OB-GYN. Today, we're unpacking the myths and misconceptions that fuel fear around doctor visits. But before we dive into that, let's pick up where we left off last episode and revisit colonoscopy. So, I finally had my colonoscopy.
Awesome.
That's
And
great news.
yeah, it wasn't that bad at all. It was,
Wonderful.
Love it.
yes, yes. I mean, it was like I told them they need to play like spa music. They need to put up some nice stuff, like Burke Williams. It was like going to the spa.
Well, it sounds like they need to figure out who's going to put the EKG leads on properly first, but I hear you.
I mean, like all the fear and hesitation and all the stories around it. Even, I mean, for me, even the prep wasn't that bad. It was, I think, the maybe the most kind of strangest thing was just being so tired going there because I was, it was a morning procedure, so I was up all
Mhm.
day. But wow, it was like better than going to, better than
Right. And
now.
I think that's what people have their biggest concern and fear about getting it done is that it's going to be somehow very uncomfortable procedure, very embarrassing procedure to have done, and it's not as bad. So I think people fear the prep. So how did your prep day go without eating solid foods?
It went really well. I mean, for me, it was, thank God to chicken broth. I would just a little like pinch of chicken broth and hot water, and I was pretty busy at work. It wasn't kind of one of those rush to the bathroom. There was
Mhm.
nothing like that for me.
But what time did you start your prep?
I started my prep when we're saying start, I started
Yeah.
it.
Like you take the medication.
The medication was at like 6 p.m. or
Yeah.
actually no, it was 4 p.m.
Yeah. So I think back to what we said on the previous podcast, like when I did mine, they wanted me to start at 2 p.m. So I took a dose of liquid prep at 2 p.m. and then one at 9 p.m. And from 2 to 9 p.m., I probably went to the bathroom at least 10 times. So for people to hear that you were at quote work, we have to clarify you work from home so
Yes.
that the bathroom is readily available. So for people who work not from home or not with a readily available bathroom, when you start the medication part of the prep, you really need to be close to a bathroom. That's the only caveat that I would say.
Good
Yes.
point. Really good point.
So I have a question. You take like this Zoran pill 30 minutes before. For me, it was a Sutab, Sutab.
Hmm. Yep.
What's the reason for that? What does Zoran do?
I'm not familiar enough with all the different prep regimens. There's a few, so they're all laxatives, is what they
Got
are.
it.
They're
Got it.
laxatives. They're usually osmotic laxatives, where they'll pull a lot of water into the inside of the intestines, what we call the lumen, and that helps liquefy everything and just move it out.
Yeah, it wasn't. It was, of course, it's a private. Once you need to clear your body. But it was good. It wasn't as horrific as I anticipated. Uh,
Well, I think that's, you know, kind of tied to what we'll get to in a few minutes. Is I think that none of the stuff is nothing in medicine we design to make people miserable. Like, I mean, like, the evolution of this prep has changed over the years to be, a little more comfortable and easier. And like nobody as a provider wants our patient to be miserable. Like, nobody wants you to have pain. Like nobody wants that. So it's not meant, it's like, it's designed to be much more user friendly, and that's great. There's different regimens, it's not just one, but the Sutab one is kind of what I'm seeing most often nowadays.
Yeah. Yeah. And the most miserable part for me was just reading the directions and following it. It was a lot of what?
Details, the details that nobody reads.
Yeah, and everyone's the doctor. Oh, it's fine. It's gonna be easy. I said, yeah, if you've done it once, you kind of get it. But if it's your first time, it's like following, like an IKEA instructions probably. You're like, I have to take this 12 pills with water, and pill sip, pill sip, pill sip, and then what? But a lot of it had to do with last week's episode that you both you really helped ease my mind, and how simple was, or as a patient I just really just went there, you know laid down, did what they need to do, and they wheeled me in, and I woke up, and that was it. It's like,
Yep, that's
right.
the most common story, which is
Yeah.
the hardest part is the prep, which isn't that hard, and the procedure itself
Right.
isn't usually a big deal.
And when you woke up, how did you feel? Gassy, hungry, tired,
I wa-
refreshed?
I was not gassy. I was tired. I was actually in a good mood, and I
All
was
those anesthetics and what they do to your brain.
I walked to the car. I was picked up at the curb. I was dropped off at the curb, on the wheelchair, picked up at the curb. But I get why you have to be driven back home, just because I was
Well, you do get
tired.
sedation. They give you medicines through the vein to help you go into a light sleep.
Yeah,
And those medicines are an intravenous thing, and they work quickly, and then when they turn it off, they go away quickly, but they don't go away immediately and fully. And so you can have a little bit of a hangover, so to speak, not like a throwing up, typically not a throwing up and vomiting headache or a hangover, sorry. But you probably should not get behind the wheel and operate a motor vehicle, or what is the other thing they always say? Heavy equipment.
yeah,
Right.
yeah. It was really, when you get a deep tissue massage and you fall asleep, and then they said, okay, it's done, wake up, and that was my feeling. I was like, oh, can I sleep a
Yeah.
little more? And
You're like, can we do this again?
you do this again, I don't mind this. So I had a good colonoscopy experience, so
Most
that,
people do. I mean, remember, your gastroenterologist, who's the specialist who performs the colonoscopy, doesn't want you to be miserable. There are no physicians out there who are like scheming to figure out, like most medical organizations and physicians. I mean, they're scheming how to make it go easier for everybody.
yeah. And today's, I think today's colonoscopy is that smooth, and I encourage anyone that needs to get their colonoscopy to do it, because it was really as not as terrifying as we all imagine it to be. And I think, thank you for last week's. You really kind of helped me, feel good about that.
Well, a lot of patients just have unjustified fears of getting procedures done or even going to the doctor's office. They have fear that is emotional, psychological, maybe based on previous visits to the doctor's office. They're worried they're going to get bad news or something is going to be done to them that's uncomfortable or painful, or more commonly, I think, and maybe more so with women, maybe a fear of even being judged for how they look, and I think from our point of view, Dr. Foz can probably agree, we are not judging the patients whatsoever. So what you wear to the doctor's office, what your feet look like, what your mismatched shoes, anything like that, we are not paying attention. We are not even seeing that at all. It really is about what we need to talk about doctor to patient.
100%. I agree with that. I can't say you don't really. The truth of the matter is we do notice, but not in ways that the average person would care about. Like, like, oh, I'm so sorry. I get so many people apologize I didn't shave my legs or something, and I'm like, I so don't care about that. Like, but if I have somebody who comes in who's very disheveled and they look like something's going on, then I worry about if they have a social problem. Is this person maybe unsheltered, or and they, and I don't know about it, and I need to get them hooked up into social services, and now they've become a high risk situation. That's when I notice things like that. But in terms of like typical social interactions, I could care less about these things. I'm more worried about fixing the problem that's in front of me or why the person is there.
Huh. So I'm the kind of patient that every time I see my doctor or even dentist, I take a shower first. And even, before my colonoscopy, I'm like, when you, before the colonoscopy, you're not supposed to have, perfume or anything, hair products. I
I
even
don't
want,
think, yeah, I don't think that's a bad thing to do. I mean, I would consider that polite, if that makes any sense.
I
But
mean,
it's not necessary.
it's much appreciated, but yeah, not necessary.
Yeah, it's a polite thing to do. It's but it's not, if something happens, we don't care. We don't. It's not. We're not there. But like, oh my gosh, her legs are so gross and hairy. Nobody's thinking that. Nobody. That doesn't even register. I think after all the years of like focusing on problems and solutions and the science behind it, like those little things don't even really register.
really. So
Yeah, it's not our job to judge people. We don't want to judge people. We want to fix their problems.
Right. And as a gynecologist, I do a lot of pelvic and pap exams, and I constantly have patients saying things like, oh, sorry, I came straight from the office, or sorry, I was out running errands, or I had to pick my kids up from school. I didn't get a chance to shower. I didn't get a chance to change. Oh, sorry, I didn't shave my legs. Sorry, oh, yeah, my toes. Don't look at my toes. I haven't had a pedicure in months. And all of those things to me are completely irrelevant. I'm not looking at you thinking that, oh, this person, isn't well kept or whatever it might be. Again, yeah, for social situations like Dr. Foz mentioned, if there's a suspicion that this person's being abused or is unhoused, anything like that, then obviously we need to address that. But the hardworking mom who just came straight from job and has put off her pap smear for, years and is finally here, it is completely irrelevant to me what your toes look like. So don't even apologize for those sorts of things. I just want to do my exam and identify any health issues that we need to discuss.
Absolutely. And as somebody who also does some women's health, same thing. I wouldn't have noticed the toes if you didn't say anything. Would not occur to me at all.
really,
Exactly.
Would notice. It's like completely, if your toes, now I'll notice if your toes are like bleeding and diseased looking, but I'm
Right.
not. But if you have like chipped polish or something, I mean, like, just
Right.
it's not relevant. It's not
Right.
important, and it's not me to care about that stuff. And it's I want that person to just make sure that their health is good and safe, and that's it.
Yeah. And as a gynecologist, I don't treat feet, so I'm not even looking at them. They're just
See,
out
I
of my
do.
way. Right. But for me, I'm just like, I don't really notice them. Maybe if you have a really pretty polish on with a cute design, I might say something, but I don't even notice them at all.
Yeah,
Whatever is
and
going on, I just really
agreed.
need access. Yeah, I just need access to your pelvis, and that's it.
So move the feet out of the
Right,
way, please.
exactly. Put your feet up in the stirrups, open up your knees, slide down to the bottom of the bed, and we're good. Everything else that's going on your lower extremities, I am not paying attention to unless you have a problem and you bring it up. But otherwise, it is not anything that is relevant to the care that I'm going to be providing to you.
So, when I see the doctor, I'm conscious about always wearing clean socks because I know they're gonna have me, take my shoes off. Socks matter? No. That's what you're gonna say.
Well, it doesn't. It's one of those things where, once again, I mean, it's noticed if there's a serious problem that could signal something else, but like we're not going, oh, those socks look a little dirty. Like nobody even that's not even registering on the consciousness. And I don't know how that happens. I think it becomes just after the years and years of training and the focus on things, and like we just we do not judge, we do not want to judge. It is supposed to be a safe, 100% safe harbor, if that makes any sense.
Good to hear. So, I saw my OB-GYN recently, and I had shared this with Dr. Ray. I found myself, oh, I'll spray perfume between my thighs and my knees.
That's very cute. That's what I will
and
say.
I told her, I said, you can go ahead and do that, but it's not, the doctor is not going to care about that. Like, they are not going to be like, oh, it smells so fresh and lovely down here.
I know.
They're not
What
thinking about
what
that
flavor
at
is that?
all. Exactly.
What scent is that, my dear?
Exactly.
Like that's
So
that's not no, not at all.
Take it off the table. So,
Well, but there are things that are, I mean, not everything is, I don't want, there are things that smell bad that, I will say this, and I'm not, once again, I'm not there to judge anybody. Like I don't, you know, I need to figure out if that smell is because of a disease, and all those
got
things.
it.
But I will say this is, after so many years of doing this, I've gotten in the habit of not really breathing through my nose when I'm
Oh, that's
yeah,
good.
I mean, things smell, and people smell and body parts smell. And sometimes that's a natural thing. And sometimes people, their personal hygiene is not the best, or they don't wear, or they don't use like deodorant type products. But I mean, that's fine. That's their own personal preference and everything. But it shouldn't prevent you from coming into the doctor. And I think that's our point that we're trying to make, is that, whatever maybe, fears that you have, or I'm blanking on the words, when self, what is it called? But anyway, you just feel self-conscious about going because maybe you don't want to go to the gynecologist because you've chosen a natural route and you've grown out all your body hair, and you don't want to be judged for having so much body hair in your underarms or in your private parts. So that shouldn't be a reason to come to the gynecologist. We're not sitting there worrying about what your personal hygiene issues are. We don't go out of the room and start talking to everybody and being like, oh my God, this girl, did you know this, blah blah blah. We
Oh yeah, no.
don't do that,
No,
at
not at
all.
all.
So
We're not
and
concerned.
especially in gynecology, because I think women are very hesitant to come to the doctors, and they don't want to get pelvic exams, pap exams done for whatever reason. Your doctor has seen the vulvar vaginal area hundreds and hundreds and thousands of times, that they're not even really registering what yours looks like versus someone else's. And I explain that to people because they'll ask me like, oh, how can you, treat a colleague or treat a friend or treat a sister or family member? And it's because I don't even recognize what I'm looking at other than a medical point of view. It's not like, oh, I delivered, my cousin's baby. And now when I see my cousin, I'm constantly thinking about like, oh, I know what your vulva looks like. No, it's like
not concerned. It's like if you showed me your
exactly.
hand. It's like if you
Right.
showed me your hand. It's I've got this bump on
Exactly.
my hand. It's like the same idea. Okay,
Right.
okay, let's. Oh, the bump is nothing, or we should do this about the bump, and it's the same idea.
Right.
It's just another body part that does things
Right.
that's different than other body parts,
Right.
and we just want to make sure it's a healthy body part.
Wow.
Right.
That's it.
So do you
Right. So
have,
yeah, so there's no reason to put off coming to the doctor because you're embarrassed about how you might look or smell or appear to the doctor. Your doctor 100% just does not care.
so do you have women that, they have to get like a Brazilian wax and like all that stuff
I
that
don't
they
have to do any of that.
care
Nobody has
about?
to do any of that.
You mean
We don't
before
care.
coming to the doctor?
Yeah, before
Bef-
seeing you.
Before no, no, not at all. They don't need to do any kind of prep whatsoever. Nothing at all.
Wow.
Show up.
You know.
Show up
Yeah.
is goal number one.
Yeah.
What about women that are about to deliver a baby, give birth? I'm sorry, give birth. Do you have you had patients where they're asking their husband to shave their legs and before?
I mean, I've had patients say that, but again, it's not necessary. I've had patients say, like, yeah, I couldn't, sorry, I can't see my legs anymore, so I can't bend down to shave them. And I'm like, I'm not looking at your legs, I'm trying to deliver your baby. So again, it's something that I think women get very self-conscious of.
Yeah.
They get very nervous about, oh, a certain part of my body I'm not comfortable with, and now it's out on display and all these people must be thinking this or something. No one is thinking that. No one is looking at that. Everybody just wants to get whatever the job done to make sure that you are healthy and safe. So when we're in the delivery room and I'm in there and I have 3 or 4 nurses with me, and maybe I have the NICU nurses or the respiratory therapists, and everybody's in there. And yes, your spread eagle and everybody, your private parts are on full display, but there's no one in the room, I guarantee, who are looking at you thinking like, oh, she didn't shave her legs before she came in. She didn't get a Brazilian before she came in. Oh, look at her toes. Her toes aren't even painted. Nobody in the room is thinking that. We're all thinking, what is the fetal heart monitor saying? How is this baby doing? What is the mom situation? What are her vitals? Let's get this baby delivered safely. Let's get this mom through this process safely and healthy. This is what's on our mind is what is the medical situation, and
Yeah, is
nobody is
everybody
worrying.
comfortable, right? Is
Right.
there any complications we need to worry about? Do we
Right.
have all the equipment that we need to do this?
Right. So there is nothing that they're concerned about for your personal body at all, other than what is medically indicated and necessary.
That's good to hear.
Yeah.
And that's a very. I hope this is a very helpful tip for, especially for, I think, younger women. You know.
For
Right.
anybody, yeah, I think for anybody. I will say that there are times when I don't want to say judge things, but that I do notice. Like, if you come to me and you in the middle of something want to start talking about your knee pain, but you're wearing skinny jeans and I can't see your knee, then I'm thinking, what were you thinking? That's when I start getting like, okay, can you like show me your knee? That's the kind of issues that I don't want to say judge, but kind of you notice, it's like that's kind of ridiculous. Are we not thinking about this situation here? But
I
whether or
think it's
not that
more,
knee has
I
been
think
shaved, don't care.
Right. I think it's more of an annoyance, to be like, oh, you came in to show me part of your body, but now it's completely covered. And how are we supposed to see that? Now you've got to take off your whole pant, like, versus if you maybe wore a dress, then you can just lift it up and be like, oh, look at my knee. So,
Exactly. Or shorts,
yeah,
or wearing shorts, or
shorts. Yeah.
you're not wearing skinny jeans, you're wearing loose pants, and you can just like check out my knee, and that's the kind of thing that. But whether or not that knee is, like I said, shaved or not, doesn't matter.
Yeah. Yeah, I can say that I'll get a little annoyed in a certain outfit that my pregnant women wear, and that's the I don't know what they call it, like a onesie type thing, or like the with like the pants and a jumpsuit,
Like a jumper.
like a jumper, yeah. And so they come in and I need to listen to their baby and measure their fundal height, and they're wearing like a whole one piece, and it's like, well, now I don't have access to your we don't have access to your belly, so then they have to completely take their outfit off, and so that's
Yeah,
just a little
there
like,
is that, like that type of
it's like,
thing is
yeah,
I would call that, like you were saying about, you shower, and we consider that polite. That's polite.
yeah,
It's not necessary. It's like a nice gesture,
just a minor annoyance.
But like maybe think about what you wear.
Right,
If you want me to listen to your lungs and you're wearing like a turtleneck and an undershirt and a vest and a jacket all zipped up to your neck, how is this supposed to work?
right,
Has that occurred to you?
right,
So when you go to the doctor, get ready to show what we need to see
yeah,
and shed what needs to be shed. Then you're not going to have judgment.
right,
And then the same
exactly,
person is wondering why we're running a little late. Well, that's why.
yeah.
Wow. Just go to the doctor and shirt, sweats, no bra.
But just be prepared.
uh,
Just be prepared. Yeah.
just get ready to just strip.
Yeah.
Yeah, the guys who come in for a checkup, and well, you walk in and they're wearing like, they're in their business outfit, their business, like got a shirt and a tie, and it's like, ties are tucked up to your, tied up on your neck, and you're like, I can't access any of this, and so it's a little, that type of stuff is what I consider behaviors that make my job more complicated. And when you make my job more complicated, that takes away my brain power to focus on you and what we can do to make your health situation and your concerns better or ideal.
That's
Right.
interesting. Have you had where women wear so much makeup then it gets on your white coat?
I have.
Oh, really?
Yeah, I've gotten foundation smeared on my sleeve.
Hmm.
Um, I have people who come in with facial skin problems and they're wearing a ton of makeup, so I can't see what their skin looks like underneath it, which I think is funny. Once again, it's the same idea. It's a little unthinking, but I'm not judging that they're wearing makeup. I'm just, well, it's in the way of what I need to do. So how are we going to handle this?
Yeah, that's interesting.
I don't wear a white coat and I don't go near their faces a lot, so that doesn't affect what I do.
Yeah.
So, but that's a good point. I didn't think about that, because people are so into so much contouring and foundation and layers. And then if they have like like a facial acne or skin something, and they go to the dermatologist, like, how is the dermatologist supposed to assess your skin if you've got layers of makeup on it? So that would be interesting. I wonder if the dermatologists have probably facial wipes that they have the patients clean their face before they examine them, if
Sometimes you
that's what the
do.
area is. Yeah.
Sometimes you do. I spent a little bit of time doing some cosmetic derm stuff, and sometimes you're like, off to the bathroom with you for with some cleansers, could you please? Or if you have a place, we had sinks and stuff in the rooms, and you just usually just, here's try this, cleanser. And we always try to find something that is, not likely to cause an allergic reaction or something. And then I just walk out of the room and give them a few minutes to wash everything off or whatever needs to happen. What's frustrating is when they won't, because they have something afterwards. Like, I came here from work. I need you to look at this rash that I've covered up with 6 pounds of makeup, and then I need to go back to work, so I'm not going to take it off. And that's when I'm like, all right.
Well, it,
I
right,
do face stuff like that. I'm like, all right, I don't know what you want me to do about this exactly. Maybe let's
right,
reschedule your appointment. And then usually they'll whip out photos that are not very good. And you're like,
yeah,
then that gets weird. So there's stuff like
yeah,
that. That's when I get judgmental because I feel that is inconsiderate, if that makes any sense. Like you're not helping me help you, you're getting in the way of me helping you.
right. Right. Yeah, I agree with that. Whatever you can do to make it easier for us to identify the problem, that is more appreciated.
Yeah, we only
Yeah.
have so much energy to devote to each interaction, if that makes any sense. And I
Right.
genuinely want to throw my 100% into that interaction. Like I want to give it all I could possibly give because that's my responsibility. But I only can do so much. And when you throw roadblocks in my way, then I have to that takes away from that energy that I should be devoting to something else, if that makes any sense. And so it's very that's when I don't want to say judge, but that's when I get annoyed. But whether or not you had BO or your toenails were not pretty, I don't care.
Or you're
I don't
wearing
Exactly.
care.
or you're wearing Dracar
Well,
from the
I,
80s.
right. I
Only
will
somebody who
say,
has to have colonoscopy done now would understand that reference.
yeah.
All right, Dr. Ray.
Yeah. No, I will say though, very strong smelling perfumes sometimes make it harder to be in the room with patients because the perfumes might be um, difficult for the doctor
Distracting. Distracting.
distracting to it and make it hard.
What
As
about
well as I will say, and maybe Dr. Foz, you can chime in about really strong cigarette smoke smelling and really strong marijuana smelling.
Oh yeah,
I've gone
we
into the
definitely smell
rooms.
it.
Yeah, I've gone into the rooms of patients and you can smell the cigarette smoke and it almost lingers in the room after they leave, and even the marijuana smoke too. And it's not often for me, it's not often my patients, it's their partner that they bring with them to the visits. Maybe has a much stronger smell of cigarettes or marijuana, and that makes it just difficult to be in the room. I would venture to say most doctors are non smokers, non marijuana users, and that smell can sometimes be nauseating or headache inducing. And to sit there and spend 10, 15, 20 minutes talking to you when that smell is so strong can be difficult on any provider for you. And then oftentimes they want to deny it, and I'll say, well, how many cigarettes do you smoke? And they'll be like, oh no, I stopped, especially my pregnant patients. And I have to say, I can smell a very strong cigarette smoke coming from you. Oh no, it's my partner. He smokes and I was just around him, So it's like, okay, if you want to play that game, if you want to play that game, fine. But usually
like
secondhand smoke doesn't infiltrate your body and your clothing the way that the primary smoke does. So I would say that, maybe that is probably the thing that I, I am most noticing and not liking about a patient that comes in versus whether her legs are shaved or her toes are done or she's got perfume on the inside of her thighs, So, and again, but it does help me to medically talk to them and be like, hey, we need to stop smoking. And for me, having a pregnant woman being around secondhand smoke can be detrimental to the development of the fetus. And then I also explain to the partner and the patient that when a newborn arrives, secondhand smoke, even primary smoke, can be related to developing lung issues in the newborn baby and having those kinds of complications, increasing the risk of asthma in the baby, increasing the risk of SIDS in the baby. And I'll talk to them. So it's kind of good, I guess, that I can smell it on them so I can address that, hey, this might be an issue in the future. But that's probably the more thing that when I walk in, I'm like, oh, this is for me, I'm sensitive to cigarette smoke. I'm sensitive to marijuana smoke. And so when I walk into the room, then for me, that's more of a judgmental problem than anything else.
Mhm.
And then the room smells quite a bit after, so we have to Lysol and sanitize the room and keep the room closed for about 30 minutes that we can't put another patient in, because I can't put another patient in a room that really
Oh
smells
wow!
strongly. Yeah.
Oh, you get to
Agreed.
like
Well, and that goes to the whole, third hand smoke, right? There's smoking, there's secondhand smoke, and then there's the third hand, which is all the stuff that clings to you that then affects people around you. So that's why we always want to nag parents who smoke to not smoke. And they say, well, I never smoke around my kid. I go outside and smoke, or, but yeah, you bring it home on your clothing and on your skin, and then that does affect your child 100%. Yes, and it's interesting because, just on that topic, I think smokers don't smell that they don't smell it anymore. And so I've had patients come in and you can kind of see people look different when they, not always, but often look different when they've been smokers for a long time. You can see some of the changes of their skin, and they'll smell like cigarettes a lot. And sometimes they'll walk in, hi, how are you? Blah blah blah. Okay, so how long have you been a smoker? And patients will like freak out. How did you know? It's like, well, I can smell it. And they're like, what? I'm like, yeah, because I don't smoke, so I can smell it.
Right. They go nose blind to their own smell. Yeah.
Mm. What about alcohol? I gotta ask you this question. So one of the questionnaires say, "Do you drink alcohol?" And I'm like, "Well, I drink alcohol, but I don't really. Like the last time I drank alcohol was, I don't know."
You don't. So you drink alcohol, but you don't drink it irresponsibly.
Yeah, but so how do you answer that question on a forum?
I just want to know, for me, how, like, do you drink alcohol? Yes or no? If you do, what is your average alcohol intake like? 2 drinks a month, 2 drinks a day, 2 drinks an hour. Like, what's a rough idea? And, we're screening for alcohol use disorder when we ask you for those things.
Got it.
So, do you do things that are you using alcohol to a level that we are certain absolutely is harmful to your health? So, like binge drinking, right? So you'll have people who, oh, I don't drink very much. Okay. How much do you drink? I don't know. I drink, I just drink once in a while with my friends. You're like, okay, what does that mean? Is that every day? What does that mean? And then, like, oh, I end up, can you just give me a rough idea? And then it turns out that, well, they drink, 5 or 6 times a year, but they go out and pound like 15 beers at a time. And you're
Ah,
like, okay. So I just want an idea to your overall pattern so that I can give you the best advice. And the advice to that would be like binge alcohol use is enough to harm your health.
mm-hmm.
There you go.
Okay. I've always lately I've been curious about that because I've kind of don't really drink. Maybe I'll have a sip here.
Well, interestingly, for a while there was the whole, you should have, a glass of wine. Your red wine is good for you, all this stuff, and that's actually not really medically supported at this time. There technically is no safe level of alcohol use. There isn't, like, it isn't like it's recommended. That's a little old fashioned, and it's like cigarettes too. It's like, there's no safe level of tobacco use, and it's just you decide what is best for you. And I think people are often surprised to hear that.
So you
But I'm
guys,
not recommending that they go out and have red wine with their dinner.
uh-huh. So you guys need like those industrial fans, when you enter the room, like psh, just kind of like fan you.
Well, actually, I'm not sure about Dr. Ray's situation, but where I currently am, we have very specialized, even in this non-hospital setting, we have very specialized HVAC. There has to be a certain amount of CFUs or whatever they call it to clear the air for infectious disease reasons.
I don't think we have
So,
that. I'm in a private practice, so our buildings are smaller, not any kind of corporate medicine or corporate
right, just
involvement
typical
or
medical
anything. It's just
suite kind of thing like
yeah,
that. Yeah.
yeah.
We have very specialized, it's designed just in case somebody comes in with measles, which is a very, very contagious airborne um, disease, and tuberculosis. So, but in general, yeah.
Wow. Well, I think we can. This is really informative, at least for me. Um, this is a good episode, and we could conclude this podcast now. And stay tuned for the next episode. Any
Thanks
comments that you
again.
guys want to end it with, close with?
No, just go to see your doctor. Don't worry about what you look like, what you smell like, what anything. Don't worry about it. All we really want is you to come in so that we can help.
I agree with that. We want to form a collaborative relationship with you. We want you to thrive and be as healthy as you can be. And that's it. Just talk to us about that. Talk to us.
Good enough.
Yeah.